Merry Christmas and a prosperous New Year in advance. Welcome to your program of choice, Health Affair on AIT, a program where we discuss everything about health challenges with a view to finding lasting solutions. I am your host, Oshuomowa Daniels. The total number of COVID-19 cases recorded in Nigeria since the outbreak in February has surpassed 72,000 and still counting, while the number of deaths is far above 1,000. Despite this situation, a lot of people still have their doubts about the reality of COVID-19. These and other diseases like meningitis shall be our focus today on the program. Please don't go away. We'll begin with that immediately after our news segment. An estimated 1 million newborn babies die each year in sub-Saharan Africa. With the current rate, experts say, it will take almost 100 years before babies born in Africa can have the same chances of survival with those born in developed countries. It is to change this narrative that the federal government is now working in collaboration with a team of biomedical experts and clinicians in some federal hospitals across Nigeria.
Deaths are mainly due to babies who are born premature, when they are born too soon, when they have what is called asphyxia, when newborn babies do not breathe at birth, when they have infections, when they have congenital abnormalities, when they have neonatal jaundice. And the statistics is that Nigeria loses about 250,000 newborns every year.
So all the materials being provided, oxygen concentrator, pulse oximeters and all that, we help to monitor these babies and provide them with appropriate care, including oxygen, so that they can survive these critical periods of their lives and grow into normal children.
This step that is being taken today is a step in the right direction and is going to facilitate and fast track our movement to the achievement of the Sustainable Development Goals by year 2030.
This is to save newborns, premature babies, and infants who otherwise may easily perish for lack of simple but effective and cost-effective technology. Very good thing. And Luth, we're very glad to have been chosen as one of the pilot sites for this rollout.
The medical team also noted that unless Nigeria looks critically at the challenge of high neonatal mortality rate, the country may not be able to attain its Sustainable Development Goals agenda soon. Nurses in Lagos State are calling on all residents to adhere strictly to the NCDC guidelines for the COVID-19 prevention. Speaking during the 10 years of the Nurse Leaders Forum, the nurses noted that if care is not taken, the second wave of the pandemic could make nonsense of the progress recorded so far.
So the trend that is trying to rise, I think with time it will also come down because the authorities are doing the right thing.
History of pandemic in the past has shown to us that there is usually first and second phase. The first phase took us by surprise, while the second phase is coming gradually because we have people coming in from advanced country. So inadvertently, COVID-19 came as a surprise, but it has helped us to improve on our services.
It's a pity. The majority of our people still believe, damn, forget that thing, COVID don't go. And so the basic precautionary measures, they are not taking heed to it. Wash your hands regularly, use sanitizer, and utilize your face mask.
Some nurses were honored at the occasion for their efforts in the battle against the COVID-19 pandemic and general contribution to the health sector.
This year we are celebrating 10 years of the Nurse Leaders Forum. In terms of the upliftment of the health sector, the nursing profession has done very well and they deserve to be commended.
The need for residents in Lagos State to embrace the health insurance scheme was also brought to the fore.
People need to know that they need to plan for their health.
by paying premium to the Lagos State Health Scheme, where you pay only 8,000 naira for a whole year as an individual and 40,000 naira as a family. Because you can never know when you will fall sick. And when you now fall sick and you are not paying out of your pocket, you may not have that money that time.
The Christmas and New Year season are usually celebrated by giving. So in the spirit of giving, a child care expert, Jadesola Durotoye, is calling on well-meaning Nigerians to remember physically challenged children. He was speaking during a visit to Modupeko Memorial Child Care and Treatment Home, where she donated some anti-malaria drugs and snacks to the children.
Thought that with all the COVID-19 problems, supplying drugs that will support the children to be healthier and more resistant to disease will help. So that is why we have brought them some medication to assist them to build immunity and stay stronger and healthier. We have malaria drugs, we have multivitamins, we have painkillers, we have and many of we have warm expellants. Oh, I want to say to people that special children, like we always refer to them, are a blessing. They are given to you because God wants to develop something special in you and for you. So what they need from you is love. If you love them, you will enjoy them.
Jadesola also noted that physically challenged children were in need of mosquito nets to prevent malaria.
Welcome back. The total number of COVID-19 cases recorded in Nigeria surpassed 72,000 and deaths above 1,000. At a point when people in Nigeria are beginning to celebrate the victory over the COVID-19 pandemic and returning to their normal routine, the second wave of the pandemic seemed to have started. The discovery of a vaccine that is said to have about 95% efficacy is indeed a good development, even though we have to wait for it in Nigeria for some time. We have with me on the show today a Deputy Director at the Nigerian Center for Disease Control, Dr. Priscilla Ibekwe, to discuss the COVID-19 situation in Nigeria with us. Dr. Ibekwe also has some words for you about spiral meningitis, a disease associated with dry season. So, Dr. Priscilla, you're welcome. Tell us latest developments about COVID-19 pandemic in Nigeria.
Thank you very much for the question. Just to let you know that we are not out of the woods yet. COVID is still here, and we are continuing to see numbers of cases reported, confirmed cases of COVID in Nigeria. And you can see all over the world, you still have some countries like in the Europe, in the US, there's a second wave already going on. And UK, for example, is on a full lockdown right now. So it's not over. And don't forget that the world is a global village. People are continuing to travel. So the risk of having COVID or having increased number of COVID, number of cases is still there. And so it's not time for us to take our eyes off the ball. It's important for us to continue to do what works. And we need to continue to wear our masks, keep our social distance, physical distance from people, and try and avoid crowded areas. So if something has worked, what you want to do is to continue. We are very fortunate with the work that has been done and the fact that Nigerians have also continued. Some Nigerians are continuing to apply the non-pharmaceutical interventions. So my advice to the country is if something works, you continue doing it. NCDC continues to provide the guidelines and support nationally. And so we support states where we hear reported cases. Sometimes we would usually send out a rapid response team that will provide additional support to the state. The healthcare is on the concurrent list, and all states have been empowered, have funds to help them respond to cases as they occur. So as they occur, they know what the guidelines are. They've got teams, all public health UOCs, that is public health emergency operation centers, have been activated. So when there is a resurgence in any part of the country, we expect the state to step up their game, and we're always continuing to provide guidance and to actually go to that state and provide additional support.
The reality of COVID-19 pandemic. Some people have their myths and different misconceptions about COVID-19. Some say it's a fabrication by government. Some say it's malaria fever. What's your message to Nigerians as regards this?
So COVID is real. The thing is, 80% of people who have COVID, luckily too, have mild symptoms of COVID. But you just have that small percentage that have very severe symptoms with difficulties in breathing and all that. We're happy in Nigeria that the proportion of people who have died from COVID is low, about 1,100. But you have, like in America, where you have 250,000, over 252,000 people already dead. These deaths are real. You don't want deaths, and you don't want to have complications. So, and you know that those who have morbid conditions, other underlying conditions like diabetes, hypertension, are at even higher risk, and the older people are at higher risk. So Nigerians have to be aware, to try and take control of their health, get the information, and do what they need to do. It's prevention, they say, is always better than cure. So right now we are coming into the dry season. This is the time where the number of cases of Lassa fever begins to increase. And because of the weather, Nigeria is on the African meningitis belt. So we have all the northern states of Nigeria, all the 19 northern states, and some states also in the south, also are at higher risk of having meningitis. So it's also to be aware of the signs and symptoms of meningitis, to make sure when people begin to that people get to know the signs and symptoms of meningitis and make sure that they also protect themselves. And one of the great things about meningitis is also keeping that social distance. We now have the vaccines. We have meningitis A vaccine that's also on the routine. It's been rolled out to make sure that kids have their meningitis vaccine.
What is meningitis? What do Nigerians need to understand about meningitis?
Meningitis is the infection of the brain. There's a covering that covers both the brain and the spinal cord. Okay, so when it's infected by bacteria and viruses, but especially bacteria, Neisseria meningitidis, the person begins to have signs and symptoms. There might be neck stiffness, difficulty in managing light, sensitivity to light. And for a child, you find that what they call the anterior frontal is kind of bulges. That little thing on a child that is less than 1 year, it kind of pops up much higher. The mothers would know. And if also when a child is finding it difficult to eat, and there's excessive drowsiness, the person is excessively sleepy. Some even may even go into convulsion. You don't want to get to that. So as soon as somebody has very high fever and there's neck stiffness, please take that person to a hospital. And as soon as that person goes to a hospital, the doctors, the clinicians there will examine and take a fluid from the back. Okay, that's called the cerebrospinal fluid. They take that fluid and check it. And if there's any bacteria there, that would help us to know the type of bacteria that is causing the meningitis. What can we do to prevent ourselves from having meningitis? what we want to do is to stay in a room or in a place where it's better ventilated. It's an airborne disease. So you want to stay in a ventilated area. You want to avoid the crowds. You also want to sleep well, take exercises, eat good food. All this helps your immunity. Drinking water, having a good diet. This helps to boost your immunity. So, like every other thing, e- every human being, every child and adult are at risk, but the children are at higher risk of having, children that are less than 5 years are at higher risk, but anybody can have meningitis. So adults have meningitis, children also have meningitis. But the important thing is to recognize the signs and symptoms: high fever, difficulty, um, difficulty with lights. The normal sun, you are not able to, you are in a room and you can't tolerate the light there anymore. Drowsiness, some even go to convulsion. So as soon as these type of symptoms begin to come up, it is not something you want to deal with at home. You want to go quickly to the hospital and get evaluated. Body, you see, you don't say never in medicine. So the fact that you have meningitis more among the younger people does not mean that you say, oh, it's only for children. Adults also have meningitis. As a matter of fact, my auntie died from meningitis, and it was just about 2 weeks to her wedding that she got meningitis and died.
Where can people go to access care if they have meningitis?
Once you have the symptoms of meningitis, please go to your local hospital. Go to a general hospital. Doctors and nurses are already well trained to identify, to make the diagnosis, where a nurse can say, oh, this seems like a case of meningitis, and the doctor will diagnose it and start off treatment while taking the cerebrospinal fluid, and to help us identify which particular bacteria, and that will further inform the management of meningitis. So please, it's very important that we all know the signs and symptoms of meningitis, and make sure you don't want to, if somebody is unwell for a couple of days, fever, and having difficulty with, seeing, excessively sleeping, that person should please be evaluated and not just take just take malaria medicines and say it's malaria. It's always better to go to the hospital and be evaluated.
Thank you very much, Dr. Ibekwe, for coming on the show. We appreciate you.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Welcome back. Now let's take you to our nutrition segment, where we'll discuss about your health and your diet. Our focus today is on watermelon. Watermelon is a plant species in the Cucurbitaceae family, a vine-like flowery plant. It is a highly cultivated fruit worldwide, having more than 1,000 varieties, but originally domesticated in West Africa. It is grown in favorable climates, from tropical to temperate regions worldwide, for its large edible fruits. The sweet, juicy flesh is usually deep red to pink with many black seeds, although seedless varieties exist. The fruit is eaten raw or as an ingredient in mixed beverages or taken as juice. Watermelon contains about 92% of water, 6% sugar, and very low in fat. This refreshing fruit has a lot of nutrients such as vitamins A, B, and C, which makes it an antioxidant. 100-gram serving of watermelon fruit supplies 30,000 calories of food energy, fiber, appreciable amount of minerals like potassium and magnesium. Watermelon is widely loved for its hydration and immune boosting properties. Taking watermelon helps in quick heart recovery, lowers blood pressure. It will be a good idea to have a taste of this wonderful fruit every day. But remember, as we always advise, do it in moderation.
See Grace, e get one party, birthday party wey dey shele for Jide house. Shey you dey come?
Me, I still dey care about this corona matter. I no wan come o, abeg.
But I think say Koro don disappear for Nigeria now.
No, it's still very much around, you know.
So I dey beg, be careful. The opening of all the sector of the economy no be excuse to let down your guard o. Continue to dey observe all the basic rules, hygiene rules to stay safe.
Knowledge, they say, is power. So to empower you to stay healthy, please come with me to our clinic.
Did you know that excessive use of medicine damages the liver and the kidney? There are lots of fake drugs in the market. Please buy your medicines from reputable pharmacy shops. Please drink plenty of water, minimum of at least 2 liters of water in a day. Brush your teeth twice daily with toothbrush and toothpaste. Exercise regularly to keep fit. And please, very important, always wash your hands with soap and water.
Welcome to our perception segment, where people express their opinion about the general health situation in Nigeria without reservation.
We have the best doctors in the world. And so what is it? What do you need to build a hospital? You have land, we have land. You have a building, the building materials are in this country. You have the doctors, raw materials we have. And then you buy some equipment, which we can get. And you can do a deal and replace them every 5 years as new technology changes. And you have the population, and you have insurance to pay for it. So really, if we don't have a great health sector in this country, that must be the most incompetent part of anybody in office. Federal, state, and local. It is as simple as that.
I wish to advise that one of the best things you can do for yourself every Wednesday at 9:30 a.m. is to tune on to AIT and watch the health affair. You will never regret it.
Thanks for spending your time with us. Please let's do it again same time next week. My name is Ushuo Mowa Daniels. Please keep staying safe.